The CDC is shortening the isolation period for asymptomatic people infected with COVID-19 from 10 days to 5. The agency updated the guidelines Monday, saying the initial 5-day period is followed by 5 days of wearing a mask around others. According to the CDC, the change is motivated by data that shows COVID-19 transmission mostly occurs in the early days of illness. Meanwhile, the Omicron variant is fueling record COVID cases across the nation. Over 52 million Americans have contracted the virus. More than 817,000 have died. The number of new daily cases has risen above 200,000 for the first time in nearly 12 months. New vaccine requirements are now in effect in hard-hit New York City, where COVID hospitalizations surged over the Christmas holiday, topping 5,500 cases for the first time since late February. The daily number of hospitalizations is up 30% a day in New York City alone. One segment of the population seeing a disproportionate increase: children. President Biden met with his COVID response team and held a briefing with the nation's governors to address an alarming spike in new infections. Nancy Chen has the latest from New York City.
Here in New York, COVID hospitalizations have surpassed 5,000 for the first time since early March. And also today, the CDC has given new recommendations for people who test positive for COVID and have no symptoms.
Tonight, a dramatic shift from the CDC. With Omicron raging and workforces depleting, the agency has shortened the recommended time for isolation after getting COVID from 10 days to 5, as long as people don't have symptoms. The CDC says it based the decision on new research. Those who are exposed to COVID but boosted will no longer need to quarantine. Those who are unvaccinated should still quarantine for 5 full days, according to the CDC. As COVID hospitalizations have been climbing, children are among those filling emergency rooms.
We're seeing a dramatic spike.
Dr. James Schneider is on the front lines at New York's Cohen Children's Medical Center.
Right now, we've moved backwards. It's really disheartening to see that this many months, if not years later in the pandemic, and we've gone back to what feels like the beginning of this.
It's happening nationwide. U.S. pediatric hospitalizations are now at their highest levels since September. In New York City, pediatric hospital admissions have quadrupled in 2 weeks. Among those patients between the ages 5 to 11, none had been vaccinated. Across the country, Omicron is sending daily caseloads soaring to levels higher than last winter's peak. New York and at least 4 other states are now reporting more daily COVID cases than at any other point in the pandemic. Last week, new COVID cases rose more than 300% in Florida compared to a week ago. And in Louisiana, Omicron has doubled hospitalizations in a week. 80% of those patients unvaccinated. As long lines persist around the country, President Biden said more testing is becoming available, but admitted it's still not fast enough. He urged the nation's governors to reach out for assistance.
Look, there is no federal solution. This gets solved at a state level.
Then out of nowhere, like a tornado the last couple of weeks, this Omicron comes in.
Just off Broadway, Sean Hayden prepared to reopen his restaurant today after having to shut down.
Those workers were getting sick. A number of them tested positive early on in December, and we were short-staffed. And in New York, it was, things were really, really good up until 3 weeks ago.
The largest citywide vaccine mandate in the private sector is now in effect here in New York City. Starting today, all workers at 184,000 businesses in the city must show proof of at least 1 vaccine dose. Elise?
Nancy Chen, thank you. For more, we want to bring in Dr. Owais Durrani. He's an emergency medicine physician in Houston. Dr. Durrani, thank you so much for joining us. What do you make of the CDC's decision to shorten recommended isolation and quarantine periods for general population?
I appreciate you having me. Look, I think with so many breakthrough infections and unmitigated spread of this Omicron variant, we had to do something to update guidance because 10 days was a one-size-fits-all solution that was simply too long. That being said, I do have my worries with this new policy. The first of it is that I anticipate that in the messaging, the 5-day mask period may get lost. And if you look back at May of 2021, the CDC said that if you're vaccinated, you can unmask. But then we all unmasked, and it led to a huge summer surge. I'm afraid that's going to happen with this, where people are just going to unmask and not follow those guidance is, and it's going to lead to issues. The second thing I'm concerned about is, what if you're at day 5 and you still have fatigue and maybe a lingering cough, and your employer is pressuring you to come back? Are there safety measures in place to give you that time to recover, and so that you can go back when you're ready and your body is ready? And then finally, we have a very important tool that allows us to get back to work and back to society safely. That's rapid antigen tests. And I wish that was a part of this policy, saying that if you test negative at that 5-day period, you can go back. Because sure, most people will not be infectious at that 5 days, but not all people. And we need to take all measures to ensure that we are not infecting each other and the workforce and everyone that we're around.
So Dr. Anthony Fauci, he applauded New York's decision to lower the number of days healthcare workers must remain in quarantine following a positive COVID diagnosis from 10 to 5. I know you just listed your concerns, but do you hope to see more municipalities and companies follow suit?
So I think as long as it's done in a way that is not harmful to the individual that's infected with COVID and it's supported by data, that's fine. And so that means testing to come back to work rather than just putting an arbitrary number there and then saying you're expected to come back to work. And so I really hope that the guidance is followed closely and that that little gray area is not left to huge interpretation by private corporations.
Yeah, you want to make sure. The administration acknowledges too many Americans lack access to testing. Do we have any idea when that might change?
Yeah, it is a massive problem. You know, obviously the Biden administration said that we were going to get 500 million additional tests in January, but that's still going to be too late. We need to, use all mechanisms necessary. I'll give you an example of what I've been seeing in the emergency department. Because there's a lack of testing, people are coming to the emergency departments to get tested. And we are short-staffed, and so that makes it harder to care for the critically ill people that we're seeing. In addition to that, you may be negative when you show up to the emergency department, but then you wait in the waiting room for 3 hours next to someone who may be positive. And so sure, you might test negative that day, but then you got COVID and you might test positive 3 days later. And so we need to put into place everything possible to get as many tests out there. That means approving new tests. That means thinking outside the box.
So what would you tell people who are trying to get tested and the lines are too long or they cannot find a test? What do you advise they do?
Yeah, so I would say avoid the emergency departments unless you're experiencing, severe shortness of breath, dizziness, you feel like you're going to pass out, you're having nausea, vomiting, severe symptoms. And the reason for that I mentioned is that you may have, the flu or some other virus, and then you show up to the emergency department and you're next to someone and you get infected. Keep looking online, keep, going on Twitter. I found that to be a great resource, using your local Twitter hashtags, following local news accounts to see who may be offering testing. I know more and more counties and states are trying to set up big testing centers. And so that's going to be something that's going to help. But it's going to be a tough few weeks. There's no easy way around it.
Yeah, and a lot of families that are having tough weeks are those with children. We're seeing a huge disproportionate spike of cases in kids. Why is that?
Yeah, it's unfortunate. I was looking at the data, and if you look at the hospitalizations, I was looking at the data in the Northeast in particular, where there's been a massive surge in hospitalizations. And if you look at the data, it's mostly unvaccinated kids. I looked at the 5 to 11 age data, fully vaccinated pediatric patients, and that's under 20% still. And so we have done a poor job in messaging and promoting this vaccine to that age group. We need to ensure that we are talking to our pediatricians, that then they are talking to parents to answer all of their questions and find out ways to get their kids vaccinated, because the vaccination proportion amongst adults in those same areas is very high. So there's a gap. It's not that these individuals are non-vaxxers. We just need to answer some questions and ensure that their kids get vaccinated so they don't end up in the hospital and that they are safe.
Yeah, it's hard to see anyone battle COVID, but children, it's just heartbreaking. President Biden told governors Monday the next steps to fight the pandemic are at the state level. Would you agree with that?
Yes and no. So we need a all-government approach. We need leadership from the top, and so the top cannot just say it's up to the states and have at it. We need the same type of leadership we got when President Biden came in, and so that includes massive vaccination sites, massive testing facilities and other resources. I'm in Texas, for example, and we have fell behind at many parts of this pandemic because we have not had great leadership. If I'm in, another state that really has taken this pandemic seriously, we might be in a good situation. And so that's going to lead to inequity in care and resources if we just leave it fully to the states. That being said, states do play a crucial role in setting up sites for monoclonal antibody distribution, in setting up testing sites, in ensuring that their citizens are getting access to hospitals and know which hospitals are full, and getting extra physicians to those hospitals, extra nurses and whatnot. And so it's going to be an all-government approach, but it cannot just be up to the states.
You just mentioned inequities. What concerns do you have around inequities as this surge continues?
Yeah, a lot of my patients don't have health care. And so I'll have patients who come in who are hypoxic and need admission, but they're scared about the bill they're going to get on the other end of that admission. And so we have so many patients that are scared of coming to the hospital, of getting care, of knowing how to access testing. Up until now, we didn't even have free testing, and we were getting reimbursed through insurance programs. And so that makes a huge portion of our healthcare system inaccessible to the most impoverished of our citizens. And they have paid a huge price for it. There have been more deaths in that group than any other group. And so we cannot forget about them. They need to be priority number one. And a lot of them are unvaccinated, not because they don't believe in the vaccine, but because they think they're going to have to pay for it, or they've never even been to a clinic. And so that whole idea of going to see a healthcare provider and getting a vaccine is foreign to them. And so that is something that we had some initial focus on, but I feel like it's gotten lost as we've moved past the spring and into the summer and fall.
That's so sad. A new study suggests coronavirus cases which cause COVID-19 can persist in different parts of the body months after infection. Is that typical behavior for a virus? And is it possible for the virus to linger in one system without being a threat?
It is not typical behavior for a virus. That's why I hate the term a mild illness or just a respiratory illness, that if you're young, you'll get over it. That may be true, but when you lose your taste, that means that virus is affecting your brain in some way. When we talk about myocarditis, it's affecting your heart. When we talk about blood clots, it's affecting your vascular system and your blood. And so there's so much that we don't know about this virus, and we don't know what it's going to do to our bodies 5, 10, 15, 20 years from now. And so that's why it's so important when we say it's just a mild illness, not to label it as that. Sure, you might get over it in a few days, but we don't know what the long-term effects of that's going to be. And so we need to have that as part of the messaging and ensure that people just don't think of it as a common cold, but that it affects all parts of your body, and we're still learning about that.
Good messaging to keep in mind. Dr. Owais Durrani, thank you.
Thank you.